Well, one thing that I think in your practice that is unique is that they're all being referred to you, not all, but many are being referred to you after they've had other folks see them and they're continuing to have problems, at least the ones you've described.
But that's not all true. I mean, I would have to, I mean, that they're not all, nope, everybody
I
at
didn't
the
say it.
clinic,
Yeah, definitely not
it
all.
says find a doc. So the patient has postmenopausal bleeding, they put in find a doc at the clinic and you say what you're having, what side of town you want it. My name shows up. So some of them have never seen anybody and they've done their own quote research. But you're right, it's a referral center. But I don't think that my practice is any different from the patients that I've never seen.
What about your partners at the clinic? Are they doing the same thing? Are they scoping everybody?
I would say yes. Yeah. A lot.
What's
Majority.
your setup in the office?
So we have three procedure rooms. Some people some days do cystos in that room. What is that other procedure? The Mona Lisa.
The Mona Lisa touch. Yeah.
I don't do that for the vaginal dryness. I'm saying you have 3 rooms that are set up and we're all given a procedure day. And so we try to schedule so you can just, same nurse. And now we have it where depending on who's in the clinic, you can do 1 or 2 go back and forth while one patient's recovering, the other patient, you're getting the consent and go back and forth. So it moves a little bit quicker.
So do you have a clinic day and then a procedure day, or do you do it all at the same time?
All in one. I mean, I was just saying some days, on the average, I would do 6 to 7 hysteroscopes. I think tomorrow I have 6, but I'm seeing new consults because I'm just back. I don't have post-ops, and there's really the post-ops I've started to do virtual because there's enough. If you hear from your patient after hysteroscopy,
right,
with the problem, in fact, I have a picture from one of my PowerPoints. I have a phone that's dangling and it says no calls. Like you said, we don't have to worry about the incision site. It's red. It's not, I don't like to stitch. It's stitching out, blah, blah, blah. If the residents know, if there's my patient or anybody, if the patient calls after hysteroscopy, except for the expected withdrawal bleeding, I tell the residents, look at the path. If I took out a big submucous fibroid and they stop bleeding and a week later they bleed, I said, first thing you do is look at their path. If it said early secretory endometrium, if there was some endometrium, that means the next week they're bleeding because they're having their period. Because you don't. So I'm just saying you don't hear from them. So we see new and consults.
So is it a mix? You'll go back and forth between your clinic visits and your procedures and kind of bounce back and forth?
Yeah, half hour. They're set up in half hour.
And then if you have a new who you're just meeting, who you weren't planning on scoping, but you talk to them, get their history.
I do it. If I can, if I look and see that the next patient is something brief and easy. If it's an IUD, I don't know why they're sending me IUD insertions, but if it's something simple, it's like a 10-minute visit, I'll go ahead. Because a lot of our patients, to your point, are out of town and they've flown in here and, it's hard to have them to come back.
Oh, yeah, we got folks from in-state that are driving 2-3 hours away. And it's a big deal to get here. So it's nice to be able to offer same day. But so one of the challenges we have, though, is, as a hospital, putting my hospital administrator hat in, we have prior authorizations we need. It's one thing to offer same day. It's something else altogether to have them get a big giant bill for it if it was not previously authorized. And those are the kinds of things.
We used to have that because I don't know what year it was. I initiated something was called One Stop Shopping Menstrual Disorders Clinic. Then for a while we had to wait to get the auth. Things that are bad where you're not getting paid, our administrators would tell us. I don't think we've seen that. And I've been there long enough. I mean, the last, say, 5 years for sure, since COVID.
What kind of scopes are you using?
So we have my workhorse, because I've been there forever, is my flexible 3.2 flexible. We have I don't want to say brands, right? Or do you on this show?
It's up to you.
It doesn't matter. Well, I don't know if you have to beep it out because, you go to a meeting, you can't say what you use. So they're all the same. 3.2 flexible. We have a rigid scope that's 5 that you can, like I would use to take out IUDs. I would use that when I was doing years ago, the hysteroscopic sterilizations in the office. So we have both of those.